prostatectomy can be done in a number of different ways. One always ends up with the same end product, so to speak. We end up by removing the prostate and the seminal vesicle, and we then stitch the bladder to the urethra. We can do that by the open technique, which is an incision above the pubic bone. We can also do it by laparoscopic or keyhole surgery, or we can do it with robot-assisted laparoscopic keyhole surgery, which gives the added benefit of improved visualization and instrumentation. Very rarely these days, the perineal approach is also used, but this is very rarely practiced because there are some disadvantages. So what's nerve sparing? Nerve sparing really means we try to protect the erection nerves at the same time as removing the prostate. How do we do that? Well, it requires a lot of experience, a lot of skill, and a lot of technical detail to actually do this in a way that protects the erection nerves. One of the critical things is not to heat the nerves, not to stretch the nerves, not to bruise the nerves, and certainly not to cut the nerves. With experience, we do learn to protect the erection nerves even when cancers are a little bit more extensive by going an extra layer away from the prostate, yet not taking the erection nerves. When we're talking about nerve sparing, it really does depend on the skill of the individual surgeon and the experience of the surgeon to be able to not only protect the nerves, but also to ensure that the cancer is removed. This is a highly technical operation where experience really does count. To find out how experienced your surgeon is, you really need to know what their overall numbers are, how many cases they're doing per year, but also their results. You know, what type of negative margin rate they've got, what type of cure rate they've got, what type of potency rate they've got, and what type of continence rates they've got.